Yersinia is NLF, non-lactose fermenter, a small gram-negative rod, motile, grow at 4 to 40 degrees centigrade aerobically and anaerobically. Yersinia can grow on SBA, Mekong, but the media of choice is CIN, Cephalosudine agar, Noabicin agar, and the organism produce bright pink colonies on this agar. This species Yersinia is glucose fermenter, nitrate reduction positive, catalase positive, and urea also positive. Among this Yersinia species, Yersinia enterocoletica is ODC positive, and Yersinia pestis and tuberculosis are ODC negative. The organism Yersinia pestis have pinpointed colony on SBA, and Yersinia enterocoletica is ODC positive and also methyl red positive and VI negative. Pseudotuberculosis are similar like Shigella species, and on TSI acid by acid no gaze and 25 degrees centigrade for 48 hours. Its Yersinia species is called plug bacilli, naturally reservoir in the rodents and rodent flies. It's a normal flora of GI of dogs, rodent, swine. It can be isolated from the blood, respiratory secretion, CSF. Mostly Yersinia enterocoletica and pseudotuberculosis are ingested from the contaminated food and water, and enterocolitis, acute appendicitis, and severe abdominal pain is observed. Growth is enhanced by the cold temperature. It can multiply at 4 degrees centigrade. The species are subdivided into the biogroups on the basis of biochemical, and 1B is most pathogenic group that produce the urease enzyme that allow Yersinia enterocoletica to survive in the stomach temperature environment, and the colonize the small intestine. Yersinia pseudotuberculosis are primarily pathogen of rodent, rabbit, and wild bird. Yersinia from the fecal specimen is considered insignificant, and the gram stain on the gram stain small gram-negative rod like safety pin-like appearance. If we isolated NLF colony, and that is methyl red positive, motility is positive, but phenylalanine diamine tests are negative, then we go for H2S, and if the H2S is also negative, then ODC. If ODC is positive, Yersinia enterocoletica. If the ODC is negative, Yersina pestis or Yersina tuberculosis, and further we check the motility at 25 degrees centigrade. If it is positive, then it is Yersina pseudotuberculosis. If it is negative, then it is Yersinia pestis. Further NLF colonies are checked for the methyl red. If it is methyl red is positive, and the organism is motile, and also phenylamine diamine is positive, PATE positive, then we suspect three species like Proteus providentia and Morganella morganae. Proteus is very easy to identify in this group because the organism have ability to produce H2S, and which distinguish it from the both Morganella morganae and Providentia. And the Providentia and Morganella morganae can be differentiated on the basis of ODC and citrate, because both organisms are positive for urease and TDA. So the ODC and citrate are positive in the case of Providentia, but in negative in the case of Morganella morganae. If we check the Proteus, Proteus is a community acquired. Proteus cause the community acquired infection, and Proteus mirabilis are a common cause of UTI, and vulgaris is a common cause of wound infection. And if you see the TSI result of the mirabilis is alkaline by acid with the H2S production with no gas, but in the case of vulgaris, the TSI must be acid by acid, and H2S with no gas. So the only alkaline reaction is in mirabilis, which is also indole negative and citrate positive. And here in the vulgaris is indole positive but citrate negative. So these are opposite to each other. If you remember that vulgaris is indole positive, you can answer the citrate also, because if it is indole positive, the citrate must be negative in this case. And in mirabilis, If the indole is negative, the citrate must be positive. Yersina tarda is also able to cause the gastroenteritis in the human, and it is linked with the fishes and turtles. They cause also the wound infection in the sea people. Similarly, appearance like the salmonella on many medias like Mekon, KXLD, and TSI, because organism is alkaline by acid and produce the H2S, and also citrate negative organism. But the only difference between the salmonella and the Yersina tarda is the indole. Indole is positive in case of Yersina tarda, while negative in the salmonella. Citrate is also positive in case of salmonella. So in case of Yersina tarda, the citrate is negative. Hafnia alvi is also gram negative rod, non-lactose fermenter. It's a normal flora of a GI, but can cause the infection. It is a opportunistic infection. Abscesses in the biliary tree. It grew well on routine media. The organism is ODC and LDC positive, and alkaline by acid. It's negative for ONPG, citrate, and sucrose utilization. Campylobacter species is a gram-negative rod, and it is a comma shape and S-shaped organism, and maybe the coccal form may be seen in suboptimal condition, cocciform. It is a reservoir in the poultry. Motility as a corkscrew, microaerophilic oxidase catalase, positive non-fermenter. Optimum temperature is 42 degrees centigrade, and cannot grow on 25 degrees centigrade. The Campylobacter jejuni is a foodborne illness. In Campylobacter coli is enteritis, and Campylobacter lari recurrent diarrhea in children. Campylobacter fetus abortion in the cattle, but opportunistic human pathogen in immunocompromised patient. The organism, the two human pathogen is Campylobacter coli and Campylobacter jejuni. Coli is heparate negative, nitrate reduction negative, while the jejuni is heparate positive. In the heparate positive, there is two species. One is C. jejuni subspecies jejuni, and another is C. jejuni subspecies docilii. The docilii is nitrate negative, and subspecies jejuni is nitrate positive. So the C. jejuni subspecies jejuni is nitrate positive and heparate positive both. A primary isolation media are CCDA agar, this charcoal cephaloperazone deoxycholate agar, microaerophilic at 42 degrees centigrade for 40 to 48 hours. The grey, white, and creamy moisture appearance of colonies. And the blood agar anaerobically is translucent and moist appearance colonies. And 800 organism is considered as an infectious dose. In infection of C. jejuni, there is a high titer of IgA, and the bloody diarrhea, leukocyte in the stool, and enterotoxins and cytotoxins in the stool also. Campylobacter lari is an uric acid resistant species from the seagulls, and pylori found in the stomach, causing the duodenal or stomach ulcer. Campylobacteriaceae have 22 species, and which Archobacter have 7 species, and Sulforospirillum have 6 species. The Campylobacter and Archobacter are a known cause of human infection. Primarily, their source are zoonotic, affecting the poultry, cattle, sheep, pig, domestic animal. The C. jejuni subspecies jejuni is a common enteric bacterial pathogen causing the sporadic infection during the summer and early fall due to the improper handling food, primarily the poultry, powder, raw milk, and water. Two age groups are frequently affected: the young children and adult from 20 to 40 years age. The first signs are fever, abdominal cramp, diarrhea with the blood, and may last for the several days or weeks, and relapses are observed 5 to 10% cases. They also include the bacteremia, arthritis, and referee syndromes. In Campylobacter fetus subspecies, fetus cause the bacteremia and extra-intestinal infection, and C. lari and C. abscelensis is also been isolated from the patient with the diarrhea and bacteremia. Archobacter boots lari and Archobacter cryophilus is also noted in the diarrhea. and also observed in the diarrhea and the bacteremia cases. Campylobacter are gram-negative curve, seagull wing shape, and motile organism, non-spore forming bacilli, typical darting motility. C. jejuni gave positive reaction to H2S on lead acetate paper, but the TSI is non-reactive. No H2S production is observed in the TSI. C. Fetus, subspecies fetus have some reaction on TSI. C. Spolorotum and C. mucosilasis has positive H2S reaction on TSI. Archobacter are error tolerant because they can grow in the presence of atmospheric concentration of oxygen, and oxygen grow an organism grow on 50 to 37 degrees centigrade but do not grow at 42 degrees centigrade. It's a haporate negative and endoxyl acetate positive organism. The main difference between the Acrobacter and the Aerotoral is the Aerotorolent, while the Campylobacter jejuni is microaerophilic, and endoxyl acetate is also positive in Acrobacter case. Helicobacter pylori is a gram-negative curve or spiral microaerophilic organism that cause the duodenal ulcer, stomach ulcer, peptic ulcer. It's motile 6 to 8 flagella at the same spot and survive acid environment up to 2 pH, can cause the malt, mucus associated lymphoid tissue, lymphoma. Helical vivo or rod in the vitro increase urease activity which protect it from the acid damage, and no spore forming, and after prolonged incubation the coccoid forms are formed on the solid or in the liquid media. Strong urea positive, catalase and oxidase positive, heporate and nitrate negative. This organism stain better observed with the acridine orange rather than gram stain. Microaerophilic but can grow anaerobically 35 to 37 degrees centigrade optimal growth temperature. Some species grow poorly at 42 degrees centigrade and 30 degrees centigrade. No growth at 25 degrees centigrade. Visible colony takes 2 to 5 days on BA. Blood agar, the colony are translucent gray with the with the slight hemolysis. On supplemented blood agar, the colony is chocolate, and Columbia blood agar is also used in the case of H. pylori, which takes 7 days for on 37 degrees centigrade. After 6 days the incubation, the moist glassy swarming colonies are observed. The gram-negative straight curve or comma shape rod, spiral or helical organism is further tested for the catalase and oxidase. The catalase negative species in Helicobacter is H. canis is the only species that is catalase positive for all the species of Helicobacter. Only the H. canis is negative for catalase, and all the species are oxidase positive and urease positive. Helicobacter is S-shape or seagull wing appearance on the gram stain. It's a flagellated bacteria. Most pathogenic strain are pylori, phenyli, and kinnidy. Phenyli is an enterohepatic Helicobacter found in the intestine but rarely cause the disease. Helicobacter pylori is a S-shape and seagull wing appearance on the gram stain. It's a flagellated parasite, and most of them pathogenic strain are H. pylori, phenylene, kinnidy, and phenylene is an enterohepatic Helicobacter found in the intestine but rarely cause the disease in developed country. 30 to 60% of infection in the adult population, but in underdeveloped countries 70 to 90% of infection, mostly from oral or fecal-oral route. H. pylori also infect the monkey, cats, dog, cattle, swine, horses, rodent, chicken, and dolphins. The organism is able to cause the gastritis, peptic ulcer, and gastric adenocarcinoma. H. phenyli and H. kinnidy is isolated from the feces of patient of AIDS. Also, they cause the proctitis and enteritis and bacteremia. The typical specimen for the culture of gastric biopsy: chocolate agar, plain heart infusion, brucella agar supplemented with the horse or rabbit blood, tire, mutton agar, and pylori agar. dense medium is also used to isolate the organism. The H. pylori colony takes 3 to 5 days at 37 degrees centigrade humid atmosphere with the low level of oxygen 5 to 10% and an increased level of carbon dioxide 5 to 12% is required for the organism. The small translucent non-hemolytic catalase oxidase urease positive uh, organism and the H. Kennedy is which Kennedy is the only organism in this group that is nitrate positive, while other pylori and phenylene are negative for nitrate. And both Kennedy and phenylene is sensitive for nalgesic acid. And but it's the rest of the species are resistant to nalgesic acid. But here the urease test is also negative for the phenylene.